Hello, I'm Susan Cross. I'm the Chief of the Chaplain Service at the Hampton VA Medical Center in Hampton, Virginia, and I want to welcome you to the community as an employee at the VA. My staff sends their welcome, and we want to tell you a little bit about what our service does. Folks know us as chaplains, ministers, pastors, pastoral caregivers, rabbis, and the important word in there for me is pastoral caregivers, because it's the kind of emotional support and spiritual support that we provide for patients and their families. And it matches the VA theme, I Care. Most of you may have a notion of what chaplains do already, but in the VA we are considered secular employees, and our primary role, is to safeguard patients' First Amendment rights. What that means is that we are there to provide support for patients in using their own spiritual beliefs and faith beliefs. Most people, when they come to the hospital, it's not the most wonderful time in their life. And people use their spiritual resources when there are hard times. And we're there to provide opportunity for them to take a hold of that as they are in the healing process and recovery. That includes worship services, Bible study, a chapel choir, conversations, prayer, work in the clinical areas, a variety of kinds of groups that we offer for patients who are here in the hospital. The other thing that means is that we may not proselytize. My staff and I cannot do that. Employees cannot do that. And when you come down to it, trying to impose your beliefs on someone else usually doesn't work. So you have to remember that in working with patients. And the thing I would suggest is the kindness and patience you show every patient and family will speak very loudly about your values and beliefs, more so than anything you can say. People use their spiritual resources when they're in times that are difficult. And the focus for chaplains in the midst of all of those tasks is to listen carefully to what the patients and family tells us, to hear their story, so that when they ask us to pray or read scripture or do other things for us, we can really address the thing that's most important to them. It's about hitting the mark rather than missing the mark. It's patient-centered, and for patients, God-centered, but not chaplain-centered. Let me just tell you a tiny bit about our staff. There's Father Cavey, our Catholic priest. There's Chaplain Maxey, who works in the domiciliary and mental health. There's Chaplain Nielsen, who handles all of our educational pieces. There's Chaplain Webster, who's in the family support program. There's Chaplain Tate, who is at hospice. Rabbi Foreman, who touches base with our Jewish patients. Reginald Haynes, who's the social work coordinator that works with us in the family support center. Laura Quintero, pairs coordinator, and our two support people, Miss Adelina Luna and Sue Collins. Each of these folks has an important role to fill, and they all do it well. We also have about 10 to 13 residents each year. We have a group of active duty Navy chaplains that are part of that, and other VA chaplain residents or fellows. They are assigned to clinical areas, so you will see them and meet them in the clinical areas in which you work, or even in the hallways. I want you to know that they do not come to us as novices. They all come with appropriate degrees, credentials, and most of them have had anywhere from 5 to 15 years experience. They are not green. They come to us to do a year of advanced study, and so they can be there for whatever kind of need you can have. Some of the kinds of services, I've mentioned a couple already that we provide, are worship, Protestant worship on Sunday at 8 in the main chapel, 9:30 in CLC, 10:30 in the acute psychiatric units. Catholic services, 3 times a week at 11 o'clock, Wednesday, Thursday, Friday, and on Sunday at 1:30. And Bible study on Tuesday night chapel choir on Wednesday night, spirituality groups in the clinical areas, and a host of other inventive things that we can figure out to support our veterans and their families. We are available every day of the week at any time of the day. During the normal business hours, it's easy to get us in our offices at 3600. But after the normal business day and on weekends, we ask you to call the operator and they will get an on-call chaplain for you as quickly as they can, so that we can be there for patients at any time of the day. There are a couple other things that our service handles. We handle decedent affairs, all the details that a family must address and take care of after there has been a death of a loved one. There's a lot of details and they get complicated at times, so we're there to help them walk through those things and at the same time provide support. Because they come through chaplain services, the families come to us and we're able to talk with them, support them during a time of loss that typically is very significant, very powerful, and very hard for folks. The other program is our family support program. It was started as a pilot program to provide counseling for couples and families, and the theme that we really thought of as we developed this program was when a warrior's wounded, a family's wounded. So we're there to provide support for a veteran and their family. Folks come all the time for couple and family counseling with an individual chaplain counselor. And we offer a workshop 3 to 4 times a year for couples to come and build and learn skills that will help them bond and stay together and communicate well. It's an evidence-based curriculum, not a faith-based curriculum, developed by the PAIRS Foundation. PAIRS stands for Practical Application of Intimate Relationship Skills. So it's much easier just to refer to PAIRS, but it's about building relationship. It's about building connection and keeping it. This program has had tremendous success throughout VAs all over the country. And it not only is good for the weekend, research has shown that it lasts well beyond the weekend. I think one of the most touching things is what couples say at the end of the retreat. One couple that comes to mind was a couple that said to us, "We didn't think we were going to make it." And they'd been married 10 or 15 years, long time. And then they said, "But you have given us the tools to grow old together. We have some hope about where we're going now." So that is something we can give to not only our veterans, but our families of veterans, and give them the support not only that they need, but that we think they really deserve. We're here to help patients and families. We are here to care. And I want you to know that's for you as well. We want to support each and every one of you joining the VA community as an employee. Sometimes that day-to-day connection is how we get to know you. But other times employees will call us and say, "Can I come and talk?" Please feel free to do that, knowing that our conversation is confidential and that we are there to support and help you in any way we can. Thank you for this time, and Godspeed.